I remember a doctor from an African country who came walking through our warehouse one day, and she reached over and she picked up a small plastic item, and she said, "If I'd had this last week, I would have saved that baby."
We've heard of doctors actually using one hand to do a surgery because they need to conserve their surgical gloves.
When they tell us about washing out 4x4 gauze in the stream and reusing them, that breaks my heart.
I've been in hospitals in Guatemala where just 2 weeks before they got a child's monitor, and that monitor saved the child's life.
I had no dream, no idea, no inkling that MedShare would become as big and a significant player in the international aid and domestic work as it has.
Those early days we get very nostalgic about because it's the little engine that could, and when it can, it is like, oh wow, we really did it.
I've been involved in a lot of nonprofits, but MedShare is the one where all the pieces line up.
We take excess materials that are here in the U.S. that typically would be discarded in landfills, and we repurpose those items to improve health outcomes around the world.
The hospitals were throwing away stuff every day that they knew was precious in other parts of the world. The nurses were almost hugging AB saying, yes, finally.
MedShare was able to send gloves, gowns, masks, and head coverings. We heard back from Mount St. Mary's Mission Hospital in Zimbabwe. The hospital has been transformed.
It doesn't matter what part of the world you're in. Even here in the United States, the need is there.
When an MRI machine, a CAT scan machine, a sonogram machine is delivered to, for example, a village in Ghana, MedShare trains people to use them and also trains them in how to fix the equipment.
I think MedShare was ahead of its time. The fact that they've been doing it for 2 decades only attests to their integrity, their relationships, and the trust that all parties who work with them have.
One of the treasures of MedShare is that they share.
This is really a smart place. We need to take this chaos of stuff that got put in a bin at a hospital, and then you get to make order out of it.
We now have 20,000 volunteers working in these operations.
We put the medical supplies and inventory into our database, and we allow our recipients to select box by box what they need. And we align our shipments with the health priorities and challenges that these communities face.
That was the greatest blessing I've got so far in life, being able to reach out and seeing the joy in their faces.
In some places when I go, I shed tears. But after MedShare has stepped in, I smile.
We're no longer in our adolescence as an NGO. We're a bona fide true adult.
It's gone on to be sustainable in its own right, both because of its reputation and because of the professional mechanisms that have been built into it.
This global community, it tethers us, it connects us. These issues require a global response. We saw this during Ebola.
A disease process that's identified in Indonesia can be in Indiana overnight.
An organization like MedShare that takes what we have in excess to share them with people with great needs is very, very important.
If you get to know MedShare and you get to know its beating heart, you'll see that it's that alacrity in responding to the needs of another man or woman or child around the world that makes it such a joyous place and provides a level of satisfaction for all of us involved in the organization that I think is unparalleled.
When you think about that one box of gloves, it's not 500 gloves, it's 500 patients. It's the medical staff that's treating them.
When we can really start to go deep into communities and affect change, that's the prize.
Where there's health, there's hope. Quality health care is the basic human right that I think we should try to afford to every individual on this planet.